This week's question is, can myeloma run in the family? Well, the answer is fairly clear. If you ask 100 patients, 100 myeloma patients, has anyone else in the immediate family ever had myeloma? The answer is yes, about 5 to 7% of the time. So 5 to 7% out of 100 would say yes. A mother or father or a brother or sister has also had myeloma or something rather similar. So what is the nature of that myeloma? Well, typically what happens is that we discover that a typical myeloma patient recalls that, oh my gosh, this is something that my brother had or that my mother or father had. And so it's something that has occurred in someone of the same age, typically over the age of 65. And so it is a typical myeloma. This is not an unusual type of myeloma. It's just a predisposition to myeloma in members of the same family. Right now, there is no particular test that we can offer to diagnose this tendency. So we don't have a genetic marker to say, oh gosh, if that's positive, that then there is this risk within the family. It's sufficiently low of a risk that we really don't have any strong recommendations to screen for this or really look extensively for this. So if there has been another case of myeloma in the family, you do not need to have, for example, children screened for this because we actually have no screening test. However, with the awareness, when the appropriate age is reached, which is beyond the age of 55 or into the 60s, as a part of regular medical checkups, it could be included as part of the assessment. And so what one could do is say, okay, there is a family history of myeloma. Let's check and make sure that I don't have myeloma. And this would be done by running a serum protein electrophoresis test, an SPEP, S-P-E-P, and a UPEP, a urine test for any monoclonal protein in the urine, a UPEP test, and then also a free light test to see if there are any extra light chains in the blood. If all of those tests are negative, the chances are 99% of the time that there is no myeloma. If that test is negative, then it could be checked occasionally, perhaps every 5 years. There could be a recheck of that just to make sure that there is no evolving myeloma. But with these kinds of percentages, it truly is quite unlikely, and this is really not something that should be an ongoing anxiety within the family. So if it has happened, when someone gets to that age of into the 60s, it should be part of the medical checkups, but really not something that has a high likelihood of ever happening.